I've been a GP for 27 years and I learnt about the importance of end-of-life care the really hard way. As a junior doctor, a young GP on call, I had a patient who died badly because we hadn't talked and nobody had prepared. And since then it's been my privilege to look after so many patients, some of whom have had quite a good experience, some of whom have had a really good death. It's not just them, it's their families too. End of life is something that affects everybody. It is something that if we plan for, we can't always guarantee a good death, but we can stack the odds in our favour in such a big way. The gold standards framework is an extraordinary thing. In this busy world where nobody's prepared to talk about death, we've airbrushed it out of society, they have been brave enough to come and say, actually, we need to talk about dying. And once we've started talking, and I don't mean just we, the healthcare professionals, I mean we, the healthcare professionals, with each other, with patients, with families, then we can start to plan. And planning is all. If someone's going to have a good death, you can't take anything for granted and you can't leave anything to chance, because death doesn't follow a roadmap. It happens at surprising times. So by making sure that we're looking at people who are likely to die in the short term or medium term, we can be prepared for the worst and hope for the best. There are thousands of extraordinary men and women working tirelessly to bring good deaths and good end-of-life care to as many people as they possibly can. But of course we need more. We need every health and social care professional in the country to be bought in to the concept of working and using the tools we've got to help everyone achieve a good death. But more than that, as a society, we have got to start talking. If we don't start talking, we won't know what people want. If we don't know what people want, we're much less likely to be able to give them the death that they perceive as good.